Welcome to the award-winning Women in Healthcare Leadership podcast series brought to you by Medscape Education. Our mission is to educate, advocate, and inspire women in healthcare to lift as they rise. Each episode brings you voices of leaders who are breaking barriers and leading the way in advancing women's health. Join our global community of listeners as we hear from her. Ready to be part of the movement? Let's dive in. Hear From Her has focused on elevating women in healthcare, the importance of recognizing how conditions impact women differently, and the need to have women at the table to articulate that lived experience. Today, we will be talking to two Medscape leaders who are championing a broader initiative with education to elevate women's health beyond just reproductive health. I am so excited to be talking with two of my colleagues today, Sara Thorpe, who is our Director of Clinical Strategy, and Eliza Reshefsky, who is our Director of Strategic Partnerships in Women's Health. Hello to both of you.
Hi, Stacy.
Hey, thank you for having us.
We're glad to have you here. So, today we will be talking about the Innovations in Women's Health Coalition. Before we get started, Eliza, could you share with us a little bit about the Innovations in Women's Health Coalition and who are the key collaborators?
Thanks so much, Stacy. So, just to take a step back, women in the US continue to have worse health outcomes than women in other high income and developed countries, which suggests that the US healthcare system struggles to meet the needs of many patients who are biologically female or female identifying. And so, clinician shortages, the lack of an integrated care team, patient delays in seeking care because of their own caregiving obligations, what else? Time constraints, access to local care, inadequate clinical guidelines, insufficient focus on addressing the social determinants of health, and negative encounters with the healthcare system in general are just some of the barriers we see to optimal and equitable care of US women. So, in an effort to expand our commitment to close those gaps in women's health, Medscape created the Innovations in Women's Health Coalition, which I'm just going to refer to as the IWHC moving forward. So, Medscape Women's Health has committed to serve as the convener, and we've brought together some key organizations and agents of change to further invest in elevating women's health and addressing these disparities in care. The IWHC's founding members include women's health leaders from the American Medical Association, the March of Dimes, the National Association of Nurse Practitioners in Women's Health, which you may know as NPWH, and the Society for Women's Health Research, which goes by the acronym SWHR. If optimizing women's health is an integral part of societal well-being, then ensuring equitable access to comprehensive and high-quality health care for all women is essential for creating a thriving and just society. The IWHC's mission is to strive for a future where all women have equal access to quality health care and opportunities for optimal health and well-being. So over the past year, the IWHC has been working to effect change through the development of education for clinicians, patients, caregivers, and also by promoting research related to the issues affecting women's health. The IWHC launched a dedicated Women's Health Learning Center on Medscape's platform, and Learning Center offers free accredited education and resources for the entire healthcare team practicing across women's health specialties. So, as we look to the future, the IWHC remains steadfast in our commitment to guide and drive forward the development of relevant educational resources and materials that will confront these challenges.
So, what drove each of you in your personal and professional interest to support the IWHC initiative?
I could start with that one, Stacey. So, for me, this work with the Innovations in Women's Health Coalition is the culmination of my professional and personal journey in many ways. Throughout my career in public health, I've had the privilege of listening to women in WIC clinics and safety net waiting rooms and walking the halls with refugees here in Georgia and women from all walks of life, whose symptoms were often dismissed, misdiagnosed, misunderstood. And these stories have really stayed with me throughout my career. And not just as, a powerful point of reflection on some of the systemic gaps that we know to be true in healthcare, but also as in the back of my mind, that call to action that motivates me in my career. It's really shaped how I approach my professional path and now medical education here with the work that we're doing through the Innovation in Women's Health Coalition by focusing on not just around the clinical evidence, but also how to listen to your patients, how to listen loudly, how to observe empathetically and with humility, and to really identify some of those overlooked patterns and create that space in healthcare for the voices of the patient.
And how about you, Eliza?
Oh, first of all, that was just beautiful, Sarah. Personally, I think, this has been a lifelong journey from an early age, whether it was marching side by side with my mother and my aunties in various protests growing up in Washington, D.C., to my time in school studying gender and sexuality, to a time at the Women's Rights Project at the ACLU. All aspects of my career have been founded on the basis of women's rights, women's equality, and gender equality throughout the US. And when I say that all health is women's health, we're not simply discussing reproductive health. And so during my time at Medscape, we have developed a number of phenomenal women's health partners, and bringing together these organizations with a common goal and dedication to women's health has proven, or rather has enabled us to develop a coalition and a platform to help enact change.
Well, I have to say, I am very impressed with both of you, and I think this initiative is in exceptional hands. Thank you both for sharing that. I'm curious as to, you mentioned a little bit about your personal experience, but when we take a look at the healthcare environment, why was something like the Innovations in Women's Health Coalition needed in education?
I would just say that despite all of the advances that we've made in medicine in recent years, there are still gaps for women across the US in healthcare.
Yeah, and I think, Eliza, you've touched on this already, right? Like women's health has often been defined by reproductive health, reproductive care. That brings into mind areas like contraception, conditions impacting the uterus. But this narrow definition really overlooks, chronic, complex conditions like autoimmune diseases that impact women disproportionately, cardiovascular disease, chronic pain, migraines, overactive bladder, UTIs, where women are both overrepresented in those conditions but underserved. So, really, through the work of the Innovations in Women's Health Coalition, you're bringing together specialties across these disciplines and care settings to elevate those overlooked symptoms, conditions, to enhance understanding of gaps in knowledge, gaps in diagnosis, to advance outcomes for women. So, when we limit that women's health is just reproduction, we miss those critical opportunities to intervene early and really improve patient outcomes. Because in reality, women are living and dying from a breadth of chronic conditions that go much further beyond reproduction. And I think some of this falls within the legacy of medical research where, participation in clinical trials and data have defaulted to male bodies. And that history has led to flawed diagnostic algorithms, again, misdiagnosis, and systems level inequities that continue to lack a reflection of those lived experiences of women. And I saw a survey recently that, it's a little bit older. It's from 2019, but still really interesting. And it revealed that fewer than 25% of sessions within medical schools address sex and gender influences. And so I think this really highlights where we can come in and leverage our collective power through the IWHC to bridge those gaps in understanding of how biologic differences in women can impact disease presentation, diagnosis, and treatment.
How is the IWHC helping to bridge the gaps that you had just discussed?
Yeah, I mean, there's a lot of work that needs to be done in this space. And, again, we're leveraging the expertise of our powerful partners that are sitting at the table with us to share key learnings and share resources to create continuing medical education programs that will tackle some of these systemic issues that we've been discussing. So, one unique thing that we are doing is developing patient facing education that is designed to really activate and equip women with the confidence that they need to engage their healthcare team. So, we're providing them with tools to help the patient understand the importance of representation and clinical trials, better prepare for their healthcare visits, and advocate for themselves, as their symptoms continue to persist, and even have conversations with their healthcare team around advanced therapies and when that is warranted. Because we know that when patients are informed and confident, they really become that powerful catalyst for change. And so I think that is something I'm really excited that the IWHC is prioritizing this year.
Now, Eliza, I know you work with a lot of the different partners. Are the partners helping to contribute with the patient resources as well?
Yes, absolutely. Not only the patient resources, but our founding coalition members are really serving in an advisory capacity. They're providing oversight, counsel, and of course, their subject matter expertise.
So, how does the coalition aim to drive change in this landscape?
So Liza has, touched on this a little bit, but the partners and Medscape really view this as a silo breaking coalition, one that's really rooted in collaboration and shared purpose. So, again, we're excited to support the work of our partners, which includes Society for Women's Health Research, March of Dimes, and PWH, and the AMA. And so together, we're amplifying each other's efforts and exchanging those different perspectives and voices. But through our education, we are really aiming to highlight those sex differences in clinical practice. So we're integrating latest research on biology and hormonal differences into the CME programs to help clinicians really tailor their diagnostic approach and treatment choices more for the patient that is sitting in front of them. So we'll leverage case based learning and present healthcare professionals with real world scenarios that will help demonstrate how conditions can really impact and present uniquely in women. And again, we're convening experts across disciplines to break down those healthcare silos and create a more cohesive care model to encourage care teams across specialties to define and align with their role in improving the care for women. And we're bringing that patient piece again to accelerate and elevate that lived experience that is happening in the community.
So, with regard to the coalition, does it live on Medscape education? How does it align with Medscape's overall goals?
Yeah, I think the Innovation in Women's Health Coalition is a natural extension of Medscape's core missions in terms of, improving patient outcomes, accelerating clinical competence and confidence. So, at the heart of the coalition is a commitment to data informed practice changing education. So, we're recognizing that power of cross specialty learning. So, bringing together the different healthcare professionals that touch the female patient across their life course, whether it's cardiology, rheumatology, neurology, psychiatry, primary care, you name it, we got it. So, mirroring how women present in that real world clinical setting and really highlighting those clinical challenges and complexities there. We believe that through continuing medical education, we can mirror that complexity of modern medicine and ensure that clinicians don't just learn the what, but the how, especially in areas where textbook knowledge may fall short.
Mhm. Now, you had mentioned a lot of different conditions that are beyond reproductive health, but can you give us some examples of conditions that are underdiagnosed or misdiagnosed in women?
Yeah, I mean, I think that's a really important question and one that we could spend a lot of time talking about, Stacey. First, it highlights some bigger issues that we've been talking about, which is that Like I mentioned, women's health has been understudied and misunderstood. And, male bodies are the default oftentimes in medical research, and that has serious long term consequences. But, as we look at specific conditions, think about heart disease. It's the leading cause of death among women, yet women are 7 times more likely than men to be misdiagnosed in a heart attack. Conditions like lupus, migraines, endometriosis, patients are suffering significant diagnostic delays as compared to their male counterparts, taking up to 7 years. And it's important that we don't forget about the pediatric perspective as well, because we're talking about enhancing women's health across the lifespan. And that certainly starts early on. One example that comes to mind is ADHD. ADHD in girls is often underrecognized because it presents, much more subtly than boys. So those biological sex influences on how diseases are showing up and how the treatments work, from hormonal to metabolic differences to, the cellular processes. We've made a lot of progress, but I think it's really important and critical that we keep this conversation at the forefront so that when this patient shows up in your waiting room, they receive the most timely and accurate care that they deserve.
So, Eliza and Sarah, what are the future goals, short and long term, of the Innovations in Women's Health Coalition?
Oh, I can take that one. We have quite a number of goals moving into the second year for the IWHC. And, the first is, of course, continuing to expand beyond reproductive health education. We are looking to bring on additional organizations with specific subject matter expertise to have clinically appropriate representation. In addition to this, and building on, the educational efforts that we have made in the US, we are looking to take the IWHC global. So we're building on the success of the IWHC's efforts in the US over the past year to expand and inform clinicians globally and support women around the world. So through this expansion, we're excited to welcome international organizations as new members and help address some of the women's health issues on a global scale.
So, as we're wrapping up our conversation on the Innovations in Women's Health Coalition, I can think that some of our listeners might be wondering, how can we get involved? How can we tap into this resource? So, we're going to make sure to put that in the show notes for you, a link to the new collection that has all of these different resources. In addition, Eliza, I know you mentioned about the expansion into the global space. Is it something that folks could reach out to you if they're an organization, since I know this podcast is heard around the world and they're interested in getting involved? Are you the person they would reach out to?
Yes, absolutely. Please reach out to me. My email address will be in the show notes. And also, I encourage everyone to go check out the IWHC destination on Medscape. We will include that link also in the show notes. However, the URL is medscape.org/sites/advances/IWHC.
That's a lot of backslashes.
It sure is.
So I want to thank both Sarah and Eliza. Any parting words, Sarah, from you as we're leaving?
I would just, encourage everybody to come check us out and encourage you to also share these resources, these tools with your teams, with your colleagues. We look forward to seeing you on the IWRC page.
Sounds like a great way to wrap it. Thank you again. To our listeners around the world, thanks for joining us today. Tune in as we continue our journey to amplify the voices of women leaders in healthcare. Hear From Her is brought to you by Medscape Education. Please subscribe to Hear From Her on your preferred podcast channel and follow us on LinkedIn. Until next time, remember to lift as you rise.